Dr. Aparna Jaiswal. I am Director in the Department of Cardiac Pacing and Electrophysiology at Fortis Escorts, Okhla, New Delhi. Today, on International Women's Day, we need to talk to you about how can we transform the cardiometabolic risk for women's health. I think it's important to understand that even beyond the healthcare inequalities, women have unique challenges. Of course, women like men counterparts have problems like diabetes, hypertension, smoking, sedentary lifestyle. But coupled with those, there are furthermore stemming from pregnancy, from menopause, and of course, oral contraceptive use. We have to understand that the high glucose levels, insulin resistance are pro-inflammatory. They push the women to developing cardiovascular diseases. Diabetes increases the risk of cardiovascular disease, and at times the risk in women is even more than what it is in men. Pregnancy. Women experience significant physiological changes during pregnancy, and this can lead to complications such as gestational diabetes. There's something called eclampsia, where the women have very high blood pressures. Apart from that, we are well aware after pregnancy, there can be pregnancy induced cardiomyopathy. That is another unique problem, and it poses so many challenges to women. Birth control. Now, we are aware that women take oral contraceptive pills. Oral contraceptive pills have their own issues attached along with. For instance, individuals who take oral contraceptive pills can sometimes become prothrombotic. They can develop clots, and that can become an added problem. Oral contraceptive pills sometimes makes them gain weight, and that in itself causes problem. They can also be predisposed to developing myocardial infarctions. The next problem is what we know in women suffer is polycystic ovary syndrome, and this PCOS results in infertility in women, as a result of which they're at a higher risk of heart disease, as a result of which they may have to tend to take certain hormonal replacements. Those hormonal replacements at times pushes women to develop more cardiovascular diseases. Menopause. Now, menopause is unique because when there is menopause, the women lose their protective hormone, that is estrogen. Along with menopause comes problems of developing high blood pressure, increased incidence of diabetes, increased weight gain, and loss of the protective hormone estrogen, which has on the heart health. Along with that, along with menopause comes this mood disorders. These mood disorders are responsible for the patient becoming pro-inflammatory and have a cause and effect relationship. Also, we understand that women as a whole have much more burden, much more stresses than male counterparts as the caregiver providers. So, having understood all these problems, we have to also discuss the mitigation strategies. I think all of us know, but it's a good idea that on this International Women's Day, we take this opportunity to share with each other as to what are the mitigation strategies that we can apply to each of ourselves so as to protect ourselves from the cardiovascular diseases, cerebrovascular diseases, developing high blood pressure, as well as diabetes. So I think the most important thing is having lifestyle modifications, being eating more healthy, incorporating regular exercise in your life, and important to understand that those women who have PCOS must push themselves further to exercise better, lose weight, because the first and foremost therapeutic strategy is weight loss. Sodium restriction amongst postmenopausal women with hypertension can be extremely beneficial. A very good strategy for that is out of your 3 meals, try and make an attempt to have 1 meal with no sodium. Thus, focusing on dietary interventions, your eating behavior, modifying your caloric intake, the number of meals per day, reducing carbohydrate intake, improving your protein intake, and as well as doing certain amount of exercises, further building your muscles is most important in all women, especially those who are perimenopausal and menopausal. Thus, I'd like to share that empower the cardiometabolic health and accelerate the resilience for tomorrow. Wish you all the best.